Hello, everybody, and welcome to another episode of Exploring the Healthcare Professions. Today, we'll be exploring the field of radiology with Director of Radiology at Illinois Central College, Professor April Tatham. Hello, how are you doing today, April?
I'm great, thank you.
Thank you for coming on in today and talking about radiology. So, as we're talking about radiology, can you tell us a little bit about your field and how you got into it?
So radiology is actually a very expansive field, but some people are not very familiar with it. I was one of those. So years ago, when I was exploring the pathway that I wanted to take for a career, radiology was not on my radar. I actually started out as a lab technologist. That was my field of study. And it took about a semester, and that semester was filled with chemistry, which you would anticipate. But I guess I didn't anticipate the degree to which I would be in a lab. And so we spent in two classes, I spent nearly 6 hours a week in a lab looking in a microscope, and realized I really wanted more patient contact than what was going to be afforded through that particular field. So I changed my mind and I went toward more of a patient focused or a person focused field, and that was social work. So I kind of really did a big flip, and I started into some social work courses, really and truly enjoyed that, but had a very frank conversation with a professor that I had about the realities of social work and how difficult it was. And through that process, I really started reviewing and thinking, is this my pathway? So in that, I then ran into a friend of mine who was in school, and she was in school to be a radiographer. And I thought, I have no idea what they do for sure. I think that early on as a high school student, I thought that maybe it was nurses who were taking the x-rays. I didn't give it much thought, I think. So I did some research and applied to two different schools. I was accepted to those schools and chose to go to Carl Sandburg College. And that's how I started my career in radiography.
Awesome, that sounds interesting. And what are the different careers that anybody can have in the field of radiology? Because I know that you are the director of radiology at ICC, and then there's different fields you can go into, correct?
Right. We refer to those as modalities when we're in the department. So we talk about medical imaging as an umbrella. And within medical imaging, like the foundation of medical imaging is radiography or radiographers. So X-ray technologists. So they're kind of the foundation. And when I'm talking to students or doing a presentation, I kind of have a visual that has a circle, the radiographers in the middle, and then from there are pieces that come off of that. And those are things like computed tomography or CT, MRI, ultrasound, mammography, nuclear medicine, radiation therapy, interventional or vascular radiology, where it's, you're making injections to look at the vascular system. And those are all modalities or other areas that radiographers often choose to, what do I want to say? They move toward that after they become a radiographer. So many of those fields require you to be a radiographer first. So you cannot be a CT technologist unless you're a radiographer. That's what I mean by that. Some of the other fields, you can pursue those areas outside of being a radiographer, but you will have to have a degree, like sometimes a bachelor's degree. So for like sonography, you need to either have a bachelor's degree in science, or you have to have an associate degree in a health related field. And they look very heavily toward radiographers because our backgrounds are so similar. And one of the things that we recognize, or that we recognized as educators at ICC, was how closely bound X-ray and CT are. So within our program, we actually prepare people for the CT side of things as well. so that if you were to go through like our program at ICC and then you would graduate as a radiographer, you already have the basis for CT through the courses that you took with us and only have to complete one more semester and take a registry exam in that to become registered in CT as well. So really preparing you during our program for two different modalities, radiography as your foundation, and then CT as well.
Okay. And with these different fields that you've highlighted, I guess what made you decide to focus on the academic side of it as being the director?
So as I was taking classes at the university, because I was at Western initially, I took a couple anatomy classes and I found that I absolutely loved anatomy. And I ended up tutoring people in anatomy. It's something that came to me very easily. I was comfortable with it. And I tutored with that. When I got into the program, I had some really great instructors who were very inspiring. And I think that process of that interaction with them and seeing what they could do to help people reach their goals, it's just something that really interested me. And so when I graduated from the radiography program, I went back to Western to finish my bachelor's degree. And then I went on to finish my master's degree so that teaching was an option for me, because you have to have at least a bachelor's degree to teach in the field, and a master's degree is preferred.
Okay, so then the next question I think that many high schoolers have is, how long will it take to complete, you kind of touched on it a little bit, but the various careers in radiology, maybe specifically the one at ICC, and is it a good financial decision?
So this is a 23-month program, and the curriculum is set for anyone coming straight out of high school, so that they can complete all those courses in 23 months. We encourage some people to consider getting their general education out of the way because it just makes life simpler for them in general, but understand they can complete it in 23 months. I think most high schoolers want to know, what does it mean for me financially? So the program itself, through ICC, by the time you paid for the tuition and any fees and your books and your uniforms, is around that 12,000 range. But students that graduate from this program within 23 months could be earning between $20 to $22 an hour. If they choose to specialize in any of those other modalities that I listed, they automatically get paid more. It's different for each one, but recognize that, again, that choice to go ahead and increase your knowledge base comes with more pay as well.
Yeah, and I think you did a good job pointing that out. I think for anybody on any high schoolers that are watching, like the good thing to point out is like, I think a typical public school that you go to, if you went to like ISU or any other four-year colleges, you're going to probably pay that in one semester. I mean, in one semester, 1 year, depending on how expensive they're asking for. So that's a pretty good deal for all the education you're getting.
Right.
And the experience.
And the good news, something else I want to point out to that, is that once you start working at one of those facilities, usually a hospital, you can work at a clinic, there's a lot of different options, but they have tuition reimbursement. So I encourage people, if you want to pursue your bachelor's and master's, I encourage that every single day, but let your employer take the burden, some of the burden of that. So within 2 years, if you started when you were 18 and you graduate when you're 20, you're making enough money to sustain yourself, live on your own. And also, if you choose to go back to college, you can do that as well. And the employer will pay for parts of that. Just depends on where you choose to go and how much it's going to cost, but you have that benefit as well. So it's something to take into consideration.
Absolutely.
Mm-hmm.
And so going off of that, what does ICC offer specifically for their students? I know you talked a little bit about how long it would take, but I guess what does specifically for your program?
So are you kind of asking what it is for what they want, what they're going to get from us outside of the program itself? I guess I'm not quite sure.
Yeah, so I guess what sets yours apart in radiology? What programs do you have that give them maybe that real world experience, or like what's the classroom curriculum like? And
Sure.
then where can they see themselves, like real life jobs? Like would they be working at OSF, Methodist, Proctor?
Right. So there's quite a bit there, and I'll try to hit all of those. And then if you need more from me, we have a cooperative agreement with Unity Point. So our students, they spend most of their clinical time at Proctor, Pekin, or Methodist. Methodist is our largest of the three, and so everyone goes through there. And then they will move from facility to facility 3 times throughout our program. That gives them a little bit more variation. They see how it's very interesting how the culture at each of those facilities is a little different. And students, like, they'll go to one place and they feel really, really comfortable there. And then the next place, like, yeah, I like it, but I really like the other one better. We want you to know that, because that helps you when you're making a decision about where do you want to apply. And for us, we are one of those programs that requires more clinical time than almost any other program. And that's 1,640 clinical hours over the 23 months, which equals to about 24 hours per week. So on average, for example, as a freshman student, the very first semester, you're only there 2 8-hour days, and only for about 8 weeks, because we have to prepare you to step into that role. As when you move into the spring semester, you're there 2 8-hour days, and then one other day that you will schedule with your clinical instructor and the other students, and it's from 1 to 9. And the reason we do that is you need to experience what's it like on second shift, because many people start on second shift. So we're trying to get you to experience some of the variations that we see between first shift, second shift. What's it like to work with only 2 people that are there in the evening versus a whole staff of people during the day? You're in class 2 days a week. So you're there for 3 hours, 2 days a week, and then you have lab. So your lab time is 2 to 3 hours, but only 1 day a week. And I think when I explain all of that, that helps some of you recognize, if you have an opportunity for dual credit, take it. Because you can get your English, your psychology, those types of courses that we require out of the way, and you're not trying to take all those other classes along with the radiology classes and the clinical. So, and we have people ask us, can I work? Yeah, you can work outside of that on a limited basis. Most people work about 20 hours a week if they can. But I just explained, you're going to be 24 hours a week in the clinical setting and 6 hours a week in class. Now we're at 30. And then we're going to be about 3 hours a week in lab. We're at 33 hours before you've taken any other classes or studied. So I try to explain that to people because it's really important to understand the commitment. It's a huge commitment. All of our health careers really are a huge commitment. But because I'm so close to my own and understand it and see it every day, it's done every year successfully. It's just people have to make some choices sometimes. Is that the pathway I want to take? And am I willing to make those sacrifices for 2 years to get to the end result?
Yeah, I think that's a good point. I think those sacrifices and that commitment might sound scary, especially coming out of high school.
Right.
However, I think the level of experience that you get from those real world experiences, and not just the in classroom work, is really going to, I know employers look for that. So,
Absolutely.
all right. And then, so on top of that, are there any good experiences or internships beyond the classroom? Because you mentioned the field work, but anything else that would benefit the students the most?
So prior to getting into our program, we require a course. It's referred to as Rad Tech 100. And the title of it is Exposure to Radiography. And the course is required to even apply for our program. And the reason for that is it takes 8 hours. So it's 8 hours of your time. That's it. in which you will be immersed in medical imaging. So we have 2 working technologists that provide that course, and they spend a lot of time explaining what's it like to be a radiographer. This is what my responsibility is as a professional. The other one works actually in CT, one works in CT. So she's able to talk about what her relationship is in that type of field. And then we also bring you into the lab. And the reason for that is it's important to understand that when we think about taking x-rays, we usually think about, oh, someone was injured and they had an x-ray. The reality of it is we do that every day, but we do a lot of other things. And so in addition to the emergency room, which we spend time, we go to surgery. And a lot of people don't realize that we go to surgery. And so some people are like, well, I don't like blood. Well, it's important that we talk about that then before you waste time, trying to get ready for a program. You don't have to stand right next to a surgeon. You're not going to be actually, but you're certainly going to be a part of that process. And so there will be certain things you see. You'll glove, you'll gown, and we go through all of that. You're going to see cardiac arrests. So we can have people, or we'll be there right after the cardiac arrest, along with our respiratory therapy professionals, because we have to take the chest x-ray to see if there's anything they can see that's happening. We're there during trauma. So someone comes in and they've been involved in a car accident. We will be called in often to take the images in the emergency room. So in addition to people, outpatients just coming in and having exams, which we do obviously a lot of those, we also have these other pieces. We have pediatric. I talk about the fact that we image people from birth to the end of their life. And that's a fact. So we may be up on a NICU unit for a baby that was born prematurely and they need a chest x-ray. And then we will be with the 90-year-old, doing chest x-rays as well. So it's just a huge spectrum. And then we've got athletes in between, and there's just every point in our lives, someone may need an x-ray either to diagnose injury or a disease.
And I think all fields have those things that, on the surface, like I work at a library, and everybody on the surface, they think one thing that librarians do, but then we have all these things under the surface that we don't just sit around and read all day.
Right.
We
Right.
do all kinds of things like we're doing right now.
Right.
And so you're saying like this is an 8-hour kind of class where they get to experience really what an actual day is like.
Yeah, and they're going to, like, they have different videos to show a radiographer doing these things. So they'll show what was their role in the cardiac arrest, what was their role in surgery, and it just goes through all of those different areas. And some people say, I had no idea. And then when you're at in the lab, you get to move the equipment, you get to see the digital imaging equipment, you get to see what it's like when a patient's on a table, how do I move the table, and all of those different aspects, just to give you a taste of it so that you can say, I hated every minute of that, or I really enjoyed that, and I want to know more about it, and I think I want to pursue it, that kind of thing. And it's just as important. I've told people in the past, it's just as important for me to find out that someone chose not to pursue the profession as a result of the course as it is for those that did decide to pursue it, because I don't want them to waste their time and money, those types of things, if that's not at all. And we do get that. We get people who start the program and then say, that's not at all what I thought it would be. And we understand that we're trying to minimize or limit that from happening.
No, I think more fields should do something like that, because I think there are a lot of high schoolers that go into college or trades and they're doing it maybe for the money or what they think it's going to be.
Right.
And I think a lot of money and time would be saved if
Right.
we could just show them what the field is. And they might even, like you said, come out of it super excited, even ready to,
Right.
like, everything's worth it. Like, I just saw this experience, I'm ready to go.
we had, all of our health, most of ours, I don't want to say all, most of our health careers have one of those courses. We're the only one that requires it. So we started requiring it a few years ago. And part of that was to minimize the loss of students after they started the program, because most people don't quit going to a program because they fail. Most of them choose not to pursue any further because they change their mind, or sometimes it's just personal circumstances. There's been something that happened in their life that then this isn't the right time. But we want to minimize the one time that someone says, oh, I didn't know. That's what we're trying to minimize. Mhm.
That makes complete sense. I like it.
Good.
And so moving on, and as we pull away from the academic side of it and getting back to just kind of the passion of it, what makes the field unique to you?
I think there's so much because, and I think that I've had a lot of people say to me, you seem very passionate about it, and I am. But one thing that our profession has been described as high tech and high touch. And I think that encompasses a lot in that we are high tech. Everything we do now is digital imaging. And our field evolves so very quickly that when a new equipment is put in, there's stuff coming right behind it that's bigger and badder. That whole conversation of how all of this changes so quickly. And that's happening in every modality. It gets faster, it gets more efficient. We use less radiation, whatever it is that we're trying to accomplish, that happens. But the other reality of it is we're actually high touch. And that's something that I've had students say to me, I didn't realize I would interact with patients that much. And the answer is absolutely you will. That your job, our job as radiographers, is to create a relationship in a very short span of time. So you have to be personable. You have to be interested in talking to people and interacting on that level so that you can bring people in to feel comfortable enough with you in that short period of time to the two of you need to prepare and have a relationship, short term, obviously, to get to the goal of providing a very high quality image. And so that whole process of you're going to be with us learning, how do I create a digital image? What happens in that x-ray tube? Because x-rays are man-made. So how does that happen? But on the other side, we're going to spend a lot of time on, okay, how am I actually going to position a knee x-ray from a patient who just had a terrible accident and part of the leg isn't in the same position it was before the accident? How do I get the patient to work with me to feel comfortable enough to get through this process without me causing any more discomfort than I have to get through it, and to create a successful images, several, to give to the radiologist? So another quick thing, I guess, radiographers are the ones who are working with the patients closely, and we are the technologists. Radiologists are the physicians within our field. So when we create an image, we then provide the image to the radiologist, who uses the image to make a diagnosis of the injury or the disease. And a lot of people get that confused. They'll come and say, I'm here to become a radiologist. Well, excuse me. Well, then that probably means you need to go to medical school. Okay. So while we have actually had a graduate of our program that went on to become a radiologist. So we have had that. And, but it doesn't happen often. They often will pursue it, but she went through our program straight out of high school. She then worked at Proctor Hospital, went to Bradley, finished her undergraduate, applied to to medical school, got in, and she is now a radiologist in the Peoria area. So kind of interesting to see that is an option, but most physicians don't take that route. But you can see what kind of a benefit it is for her to understand when she's looking at something, she knows what the radiographer did to get that image. So she has a whole different perspective than those who don't. It's just not a usual route. So I think that high tech, high touch to me to really explains what we do in our profession, that you have to want to work with people. And that was the reason I changed my mind many, many years ago, was I realized that in my first profession that I was pursuing, there wasn't enough patient interaction and I needed that interaction. And you get that with us.
And this is kind of a tangent, just a thought that I had that maybe other people have a question too, just to, but so in that case, you were just talking about that person that went on to radiology, to be a radiologist.
Yeah.
So do radiographers, they're the ones that know the tech. Do the radiologists usually know the tech, or do they just know how to read the tech or the x-ray?
So the radiologist would not know how to come in and create the image.
Okay.
That's not their job. So our job is, how do I set the technique to get the right image? How do I position the patient correctly? And then how do I tell them to breathe or not breathe, or what do I do to make sure I get the right image? So if there was an issue with an image, the radiologist might say to us, or there doesn't have to be, they may want something different. They'll call us in and say, okay, see this, I want to see this like this. Can you go get that for me? And then we have to look at it and think, what is it that he wants us to turn them that way. Yep, let's go back in. Let's turn them another 45 degrees in the opposite direction, and we'll be able to get what it is that he or she wants us to demonstrate. So we are hand in hand. The radiographer and the radiologist are hand in hand, but we have very different roles. So.
Yeah, just I thought I'd ask that question because maybe somebody else was wondering it as well.
It happens all the time. We get that question. Even people who are in the program sometimes will say radiologist. And I'm like, now back up. Unless you're going to go to medical school, you're here to become the radiographer or the technologist. Yep.
So that's very interesting. It's like somebody that reads the book versus writes the book. It's cool.
Yep, sure is.
And as we come to a close, do you have any final words of advice or encouragement for prospective students within your field?
I think I would like to just really stress that medical imaging is a very diverse field, and we have so many opportunities. And those that choose to pursue the field, recognize that from there, they can choose to stay as a staff radiographer, which is the foundation. And we need amazing staff radiographers. But at times they may say, after they've been working for a while, I think I want to try something else. Well, those fields are open to them to do so. And sometimes some of those things can be done on the job. So there's a few things still out there. Interventional radiology is one of them. When those jobs open, they can apply for them. CT and MR at some level are still like that too, although more and more people are moving to requiring them to do the formal coursework. And the reason for that is that means that they have the foundation. They don't have to take the time to really, teach them, because they already have it. So that's kind of expensive for an employer. And so I think that I've had the honor of working with hundreds of students throughout my career, and to see them reach their goals and contributing to the medical community has probably been the most rewarding part of my career. And I chose to pursue radiography at the age of 20. So I'm talking to many of you that are close to that. You're 16 to 18, somewhere in there. And in all that time, I have never regretted that decision. So I have never looked back and thought, yeah, I should have done something different. I've always just been thankful for the profession because of what it has afforded me in so many places of my life or areas of my life. Mhm.
And finally, can you highlight any support, resources, or information that anybody that's interested in the field would be able to get from you or anybody else you know?
Yep. So on a national level, we have an organization. It's called the American Society of Radiologic Technologists, and that's the website for that is asrt.org. And anyone that wants to go on there can just, there's just a lot of information. But on a more local level, I would say to review the ICC program website. And you can do that by going on to ICC and then under health careers. So it's got academics, and then under there you got health careers, and then radiographer. We have a lot of information under there. I also can't stress enough how important our health career advisors are at ICC. They are, like, I consider them anymore the foundation of our department because they see so many people that we don't get to see. And they help people make some decisions based on the interactions they have with them and what their interests are. So I think that it's very important if you have an interest in the program and you're wondering, what do I need to do now or in the future, to make an appointment with a health careers advisor. And most all of those are virtual right now. So that makes it, I mean, in some ways I like it face to face, but that's not reality right now. And so you do, most of them are Zoom like this, some of them are phone, but a lot of them are Zoom. And they're just such a great resource. And if you want to call, make an appointment, that number is 690-7530. And if you have a question and you want to just ask me some questions, I'll give you my email address. That is atatham@icc.edu. And you can email me and I can answer questions or direct you where we can find those answers. I don't have some of them.
All right. Well, thank you, April, for joining us and talking about your field of radiography and radiology and everything in between. I hope it was informative for everybody, and thank you.
Thank you. Thank you for the opportunity.
Absolutely. All right. Thanks, everybody, for watching, and join us next week when we talk about exploring dietetics and nutrition with Sarah Petty. Thanks. Bye.